Good day, students. Today we will be looking into a course titled Medical Surgical Nursing. Module 1, Nurse-Patient Relationship and Internal Defenses. Welcome to Module 1 of the Medical Surgical Nursing course. This module explores the foundational relationship between the nurse and the patient, focusing on perception, roles, and the internal defense mechanisms of the human body against infections. We begin by considering the patient's concept of the nurse. Patients often view nurses as caregivers, protectors, and advocates. They trust nurses to deliver competent, compassionate, and professional care. A nurse represents not just clinical skill, but also emotional support and reassurance. Conversely, the nurse's concept of the patient is equally vital. Nurses are trained to see patients as individuals with unique needs, beliefs, and emotional states. The holistic approach means addressing not only physical symptoms but also psychological, social, and spiritual concerns. Understanding these concepts enhances mutual respect and effective communication, which are essential for patient-centered care. In different healthcare settings, such as the outpatient department, clinics, and wards, the nurse's function varies but is rooted in the same principles of advocacy, care, and professionalism. In outpatient departments, nurses perform health assessments, provide patient education, assist with minor procedures, and prepare patients for specialist review. In clinics, nurses play a more specialized role depending on the clinic type: antenatal, immunization, chronic disease management, or wound care. In wards, nurses manage admitted patients, implement care plans, and coordinate multidisciplinary team efforts to ensure comprehensive treatment. Patient assignment in wards is a critical nursing activity. Nurses are assigned to specific patients based on acuity, complexity, and staffing. Proper patient assignment ensures workload balance and quality care delivery. Next, we examine the body's internal defenses against invasion by pathogens. The human body has several layers of defense. Physical barriers such as the skin and mucous membranes prevent pathogen entry. Chemical barriers include enzymes in saliva, stomach acid, and lysozymes in tears that neutralize invaders. Cellular defenses involve white blood cells such as neutrophils, macrophages, and natural killer cells that identify and destroy pathogens. Inflammatory response is a critical non-specific defense mechanism. When tissues are injured or infected, inflammatory mediators like histamine are released. This results in redness, heat, swelling, pain, and sometimes loss of function. The purpose of inflammation is to isolate and eliminate the pathogen and initiate tissue repair. We also consider the antigen-antibody response, a specific immune reaction. Antigens are foreign molecules recognized as threats, while antibodies are proteins produced by B cells that bind to antigens and neutralize them. This immune specificity is the basis of vaccination. The healing process follows inflammation and includes 3 phases. Inflammatory phase, removal of pathogens and debris. Proliferative phase, tissue regeneration and capillary growth. Remodeling phase, strengthening and maturation of new tissue. A nurse must understand the principles of pathogen invasion, including modes of transmission, contact, airborne, droplet, and be skilled in implementing infection prevention strategies, such as hand hygiene, use of personal protective equipment, PPE, and proper waste disposal. We conclude this module by addressing the management of patients with inflammation. This includes pain relief, monitoring vital signs, wound care, administration of anti-inflammatory medications, patient education, and emotional support.